Hi everyone, I'm Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about what tips or tricks do we have when we're trying to conceive. So let's go over this topic today. Number one, have a good understanding of the menstrual cycle, when you ovulate, and when your fertile window is. I have done a video on the menstrual cycle and I will link it here. It's important to have an understanding of the menstrual cycle because it's good to have an understanding of the dynamics and what happens in a menstrual cycle so that you can better understand when you ovulate and when your fertile window is. I have done a video on when the best time is to have intercourse, and I will also link that here. But it's important to know the approximate time you ovulate. So how do you find that out? Cycles need to be regular. Regular cycles are very reassuring that ovulation is occurring. And so ovulation will occur approximately 12 to 14 days prior to your next period. So take your average cycle length, subtract 12 to 14 days, and that's approximately the time that you will ovulate. Then the 6-day window prior to ovulation is the fertile window. So it's important to have intercourse every other day during the fertile window. Alternatively, you can use ovulation predictor kits during the fertile window leading up to ovulation to identify better when ovulation is occurring. Once you see that positive ovulation predictor kit, that indicates that LH surge has occurred and you should have intercourse that day and the next day. And ovulation should approximately occur the following day. Number two, healthy lifestyle choices. Ideally, we want patients to have a healthy BMI, and a normal BMI is anywhere from 18.5 to 24.9. In terms of diet, we usually recommend a Mediterranean diet, lots of fruits and vegetables, healthy fats like avocado, olive oil. In terms of exercise, trying to maintain a good exercise regimen of at least 4 to 5 days a week of good cardio for 30 minutes, intermittent weights, just overall doing what you can to try and stay healthy. And in addition, avoiding alcohol, smoking, drugs, and minimizing caffeine, and of course, taking a prenatal vitamin with 400 micrograms of folic acid and DHA. Number three, knowing about the age-related decline in fertility and knowing when to see a fertility specialist. With advancing female age, there is both a decline in egg number and also in egg quality. And when it's recommended to see a fertility specialist is if cycles are regular and you're under the age of 35, and if you've been unsuccessful after 1 year, it's recommended to see us. If you're between the ages of 35 and 39, and if you've been unsuccessful for 6 months, it's also recommended to see us. If you're over the age of 40, it's recommended to see us right away. Other circumstances where it's recommended to see us right away are if cycles are irregular. That can be indicative that ovulation is not happening and patients may need assistance with that. Or if there's a known fertility factor, for example, a known male factor, a known tubal factor, or a known uterine factor, it's also recommended to go ahead and see us. The reason why it's important to know when to see us is with the passage of time, there is also a decline in success rates. And we just want to do everything that we possibly can to maximize your chances of success. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.